Hello everybody, my name is Dr. Ferox and today I'm going to talk to you about Pyometra in the dog and just why it's such a major catastrophe every time we come across it. Pyometra is one of the main reasons we frequently insist that it is important to spay your dog once you no longer want puppies from her, if you wanted puppies in the first place. Now when we do a spay, we need to remove both her ovaries and the dog's uterus. It's the equivalent of an ovariohysterectomy in a human, and it's reasonably major surgery. A normal uterus that is empty is a fairly small, discrete organ that isn't too much bother. The ovaries are attached deep in the abdomen near the kidneys by these two very strong ligaments that we have to break, but they also have very large blood vessels called the ovarian pedicle that you really don't want to mess with and have to tie off very securely. There's more blood vessels running along the body of the uterus, and there's usually one or two coming through the uterine fat. Now, it doesn't always look exactly like the diagram in a real dog. There's often big sheets of fat obscuring most of the blood vessels, and often obscuring the ovary and its pedicle, which makes it very difficult sometimes. A spay is routine, but that doesn't mean that it's easy. But this is for a perfectly healthy uterus, which is the way we definitely prefer to do it. In the event of a pyometra, everything is a little bit worse. Now, the normal uterus has exactly one job, and that's to fill up with its precious cargo and provide a safe, nurturing environment for the duration of pregnancy. In a pyometra, there's no happy little puppies waiting in there. It's just pus and bacteria. That's what it means. Pyo is pus, and metra is the uterus. And if there's one thing a uterus can do well, it's filling up with stuff. So our tiny, discrete, empty uterus turns into this enormous, fragile balloon of toxicity, filling up most of the abdomen. And they do really get enormous. They can be up to 20% of a dog's body weight. Not only do they become enormous, they're at risk of rupture, causing peritonitis and death, but all their blood vessels typically get bigger as well, making things extra difficult at the time of surgery. So between the very delicate nature of removing a pyometra and the enormous blood vessels, as well as the fact that the patient is often critically sick, you'll often find the cost of a pyometra surgery to be 3 or 4 or 5 times more expensive than the cost of the elective spay. Now this still looks nice and neat and like you could manage it, but really there's often lots of fat obscuring many of those blood vessels, and the ovaries are often very difficult to get up and out of the abdomen. Things never look quite as neat as they do in a diagram, especially not in a real living dog. Now, I don't have a real living dog to demonstrate with, but I have Shelley. Say hi, Shelley. And Shelley's going to show you what it really looks like. So going into the normal dog, we first have to find our uterus, which can be difficult with all these intestines floating about. But once we've found it, we have to gently tease up the ovary so that it's high enough for us to be able to get a few clamps on so that we can remove it. And then, somehow, we have to find the other one, which we often go in behind the bladder to do. One's often a little harder to get than the other, and we tie that one off as well. Then we can take both of them and tease up the rest of the uterine body to tie it off at the cervix and remove the whole thing. In a normal dog, often the most challenging part is finding the uterus in the first place. That's not the case in a pyo. Meanwhile, in the case of a pyometra, the uterus is often very big and very obvious. It's also very delicate, and it can rupture at any time, causing a huge amount of pus to leak into the abdomen. Still, somehow we have to remove it for our patient to have any chance of survival. And this is often a very delicate procedure to get all of the uterus out of the abdomen. Meanwhile, you have a patient who's still very unwell under anaesthesia, and there's still a distinct possibility that this patient might die. You can see this is much more challenging than a routine spay. This is an X-ray of a Pyometra with the head positioned to the left and the hips positioned to the right. This abdomen is distended by a large sausage-shaped or balloon-shaped mass in its centre. You can make out the outline as indicated by these arrows. This is a pretty big closed pyo. Because this dog's cervix is closed, no pus has been dripping out of the uterus. She's been sick for approximately 2 days by the time of the X-ray. Her blood results reveal more of the catastrophe. Her white blood cells are super high, and most of those are neutrophils, which are basically her pus cells. This is because she is septic. Her blood urea nitrogen is also elevated, probably due to dehydration, but her kidneys are not happy. Most concerningly is that her albumin is so low. This is the most common protein in the blood, but without it she can't maintain her blood pressure, and she's about to go into disseminated intravascular coagulation, which is what she did. She passed away before she could have surgery. If her owners had noticed her symptoms sooner, perhaps she would have had a different outcome, but her symptoms were subtle. She had a closed pyo, so she didn't have any noticeable pus dripping from her vulva. She was drinking more, and she was lethargic. On the second day she stopped eating, so was presented to the vet clinic. Pyometra is a nasty condition with subtle symptoms, which can be prevented with an elective spay. The risk of pyometra steadily increases with age, with up to 25% of female dogs being affected if they live long enough. So if your dog is not desexed, talk with your local veterinarian about whether a spay is in her best interests. Thank you for listening. I hope you've learned something. My name is Dr. Ferox, and I'll catch you next time.